NLN NEX Practice Workbook. Question 1. Which average results from scores of 70, 74, and 78 in this scientific method item? Option A, 72. Option B, 8. Option C, 222. Option D, 74. The correct answer is option. Add the 3 scores to get 222, then divide by 3 to get 74. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 2. During a quick NEX review of a control group item, which word is closest in meaning to reluctant in a study guide note? Option A, hesitant. Option B, silent. Option C, formal. Option D, eager. The correct answer is option. Reluctant means hesitant, so that choice matches the meaning in context. Silent means quiet, not hesitant. Formal means official, not hesitant. And eager means willing, not hesitant. Question 3. After checking the choices in a sample size item, which answer identifies the process moves water across a semi-permeable membrane? Option A, mitosis. Option B, osmosis. Option C, transcription. Option D, exocytosis. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Mitosis is cell division, transcription copies DNA information into RNA, and exocytosis moves materials out of a cell. Question 4. If an enzyme activity stem gives one clear clue, which choice most accurately summarizes the passage? A patient education sheet used short sentences, headings, and pictures. Option A, clear formatting helps readers understand health information. Option B, long paragraphs are best for patient teaching. Option C, headings reduce the value of information. Option D, pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching is not supported by the passage. Headings reduce the value of information is not supported by the passage, and pictures make written instructions unnecessary is not supported by the passage. Question 5. When time is limited on a pH scale question, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart? Option A, 8. Option B, 26. Option C, 44. Option D, 5. The correct answer is option. The increase is the final value minus the starting value, 2618 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a solution chemistry item, which for flow rate delivers 1.5 L over 8 hours using a 60 GTT/ml set? Option A, 193 GTT/min. Option B, 11,250 GTT/min. Option C, 3 GTT/min. Option D, 188 GTT/min. The correct answer is option. Convert 1.5 L to 1,500 ml, then use 1,500 times 60 divided by 8 times 60 to get about 188 GTT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 7. Suppose a similar genetics clue item appears on test day. Which word is closest in meaning to significant in a study guide note? Option A, distant. Option B, minor. Option C, important. Option D, damp. The correct answer is option. Significant means important, so that choice matches the meaning in context. Distant means far away, not important. Minor means not important, and damp means wet, not important. Question 8. While working through a timed cell division set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, villi. Option B, nephrons. Option C, alveoli. Option D, bronchi. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Villi absorb nutrients in the intestine, nephrons filter blood in kidneys, and bronchi carry air toward the lungs. Question 9. Before choosing an answer in a bone support item, which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A. Personal stories can motivate people to participate. Option B. A volunteer programs grow without communication. Option C. Orientation should never include stories. Option D. A former patients stopped the program. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Orientation should never include stories is not supported by the passage, and former patients stopped the program is not supported by the passage. Question 10. A student sees this muscle movement idea on a NEX review. Which answer identifies the group that does not receive the experimental treatment? Option A. A control group. Option B. Conclusion. Option C. Experimental group. Option D. A sample. The correct answer is option. A control group provides a comparison for the treatment group. Conclusion is the final interpretation, experimental group receives the treatment, and sample is the participants or items studied. Question 11. One nerve signal practice problem tests this skill. Which value of x solves 4x plus 8 equals 32? Option A. 7. Option B. 24. Option C. 6. Option D. 5. The correct answer is option. Subtract 8 from both sides to get 4x equals 24, then divide by 4 to find x equals 6. The other choices result from stopping after subtraction, adding one too many, or not reversing the operations in the equation. Question 12. Several choices look tempting in an endocrine message item. Which word is closest in meaning to vital in a study guide note? Option A. Essential. Option B. Optional. Option C. Distant. Option D. Ordinary. The correct answer is option. Vital means essential, so that choice matches the meaning in context. Optional means not required, not essential. Distant means far away, not essential. And ordinary means common, not essential. Question 13. For this glucose regulation nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A. Antibody. Option B. Hormone. Option C. Platelet. Option D. Enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Antibody targets antigens, platelet helps clotting, and enzyme speeds chemical reactions. Question 14. In a short chart reading practice STEM, which choice most accurately summarizes the passage? A school added quiet study rooms, and students reported fewer distractions. Option A. Distractions are always helpful. Option B. Reducing distractions can improve study conditions. Option C. Quiet rooms increase noise. Option D. Students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Distractions are always helpful is not supported by the passage, quiet rooms increase noise is not supported by the passage, and students no longer needed to study is not supported by the passage. Question 15. Among the choices in a ratio setup item, which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A. Random assignment is never useful. Option B. The conclusion should ignore group differences. Option C. The conclusion may be too strong because another factor could explain the scores. Option D. Higher scores prove every student studied more. The correct answer is option. Without random assignment, group differences may affect the result. Random assignment is never useful, does not follow from the situation. The conclusion should ignore group differences, does not follow from the situation, and higher scores prove every student studied more, does not follow from the situation. Question 16. Using the facts in a unit conversion question, which increase is shown from Monday 13 to Wednesday 20 in a simple practice chart? Option A. 33. Option B. 5. Option C. 20. Option D. 7. The correct answer is option. The increase is the final value minus the starting value, 2013 equals 7. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 17. Based on the clue in a percentage item, which word is closest in meaning to analyze in a nursing entrance reading item? Option A, examine. Option B, float. Option C, decorate. Option D, forget. The correct answer is option. Analyze means examine, so that choice matches the meaning in context. Float means rest on a surface, not examine. Decorate means make attractive, not examine. And forget means fail to remember, not examine. Question 18. Consider this high-yield fraction item concept. Which answer identifies the cell division that produces gametes? Option A, diffusion. Option B, mitosis. Option C, translation. Option D, meiosis. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Diffusion moves particles down a gradient. Mitosis produces identical body cells, and translation builds proteins. Question 19. Near the end of a mean score review session, which choice most accurately summarizes the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. The refresher removed all risk permanently. Option B, a training increased infection rates. Option C, hand hygiene cannot affect infection. Option D, a training may have improved compliance with hygiene practices. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently is not supported by the passage. Training increased infection rates is not supported by the passage, and hand hygiene cannot affect infection is not supported by the passage. Question 20. Across similar probability set nursing entrance questions, which increase is shown from Monday 17 to Wednesday 27 in a simple practice chart? Option A, 7. Option B, 27. Option C, 44. Option D, 10. The correct answer is option. The increase is the final value minus the starting value, 2717 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the test strategy clue, which second quantity matches a 2:4 ratio when the first quantity is 4? Option A, a 10. Option B, 8. Option C, a 12. Option D, 4. The correct answer is option. The first part grew from 2 to 4, so the scale factor is 2. Multiplying the second part, 4 times 2, gives 8. The other values use the total, the first quantity, or an extra scale step instead. Question 22. From the information in a main idea item, which word is closest in meaning to brief in a nursing entrance reading item? Option A, bitter. Option B, lengthy. Option C, complex. Option D, short. The correct answer is option. Brief means short, so that choice matches the meaning in context. Bitter relates to taste, not length. Lengthy means long, not short, and complex means complicated, not short. Question 23. At a testing desk during an inference clue review, which answer identifies the solution with pH above 7? Option A, acidic. Option B, neutral. Option C, hypotonic. Option D, basic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Acidic describes pH below 7, neutral describes pH 7, and hypotonic describes lower solute concentration. Question 24. Inside a author purpose science or skills item, which choice most accurately summarizes the passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, appointments no longer need scheduling. Option C, patients cannot benefit from reminders. Option D, reminders can help patients remember appointments. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits is not supported by the passage. Appointments no longer need scheduling is not supported by the passage, and patients cannot benefit from reminders is not supported by the passage. Question 25. Through careful reading of a summary task stem, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, conduction. Option C, convection. Option D, radiation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, convection moves heat through fluid circulation, and radiation transfers energy by waves.